Okay, hi everybody. Kelsey Bachman, third year, here presenting to you about my placement at Primary Children's. This is my current placement. If I did last semester's, you have already heard about it from Shannon. So to keep it fun and interesting, I will talk about Primary Children's. So these are the audiologists and ENTs that you'll be collaborating with on a pretty regular basis. This is just a photo from a plaque that's in the main hospital location. It's not updated. Dr. Shelton isn't there. Also, there's Dr. Orb there now. So these names probably are familiar to you at this point, and you'll get to meet them. So that's really cool, starstruck moment. um, and then as far as audiologists go, you can see there's quite a few audiologists as well, spread between different locations, and they kind of bop around depending on their schedule. They might do a day at Maine and then do a day in Riverton, just depending on the need. So everybody does diagnostic testing, and then some people will do hearing aids and osseointegrated integrated devices, or OIs, or BAHAs, previously known as. JJ Wicker, he does APD testing in Layton once a week, and he is a recent PhD USU grad, and so that's pretty cool. Then Annie Hayden, she's a USU alumni as well, and she does vestibular testing now. So there's a few of them. Dr. Caitlin Stone is the main audiologist you'll correspond with, and for those of you who recently did interviews for this placement, you probably talked to her. So these are the locations. I spent most of my time at the main hospital, and now I do a day in Layton. This is the entrance at the main hospital. It's really cute, kid-friendly. You may bop around to Taylorsville or Riverton if there's a full day of CIs and you want CI experience. And so they're pretty flexible with you. Depending on what you want, they'll try and get you whatever that is. And so, yeah. As far as services go, definitely do diagnostics. At the main location, there's typically somebody doing ENT, there's someone doing outpatient, and then there may be somebody doing inpatient, or JJ's doing the NICU hearing testing. And so he's there almost every day doing that. As far as your variety of services, you do have a lot in any given day, and that's something I did like about this placement. You might start off with an ABR in the OR, and then go and do some ENT testing with some interesting conductive losses, or then go to the Children's Procedure Center where they have ABR tacked on with their dental that they're being sedated with. And so you move around quite a bit on most days, which is I liked. And there's a lot of variety in your patient population. There's, your standard hearing aid and CI follow-up. You also do hematology and oncology follow-up for ototoxic monitoring. Those appointments can be a little emotional, so just be prepared for that. You can tell when some kids are really affected by their chemotherapy treatment and they're just not themselves, and families, going through a lot. So those can be a little emotional, but for the most part, everybody's great. The families are great. You're also going to see a lot of variety in your patient population, as far as like lots of testing for autism, trisomy 21, complex cases, things that you've never heard of, that you'll have to Google, before the appointment that morning. So keep that in mind. You'll also get experience using an interpreter quite a bit. They have these iPads and you dial in and get an interpreter that interprets live for you through the iPad webcam. So it's nice that they have that, really convenient. It does take a little bit longer, but it's really nice to be able to communicate with those patients even though you speak a different language. So pros and cons. I started with cons first because there was only really one for me, in my opinion, but it's a pretty big con. It's kind of a pain in the butt, and that's the commute and the parking. You cannot park at the hospital, so I would drive from Ogden, which was about 40 minutes, and then park at a tracks station right off the freeway, and then take tracks in for about 25 minutes. Um, so that's kind of an ordeal, especially super early in the morning. So if you're coming from Logan, get your sleep schedule and stick to it because you're going to be exhausted by the end of the week. It's still worth it though, 100%. So pros, pediatrics, great learning environment, everyone's super friendly and supportive of your learning. So it's really great. Like I said, exposure to different diagnoses, complex cases. You get that ENT collaboration right there. Sedated ABRs in the OR I thought were really fun. You feel really official wearing your PPE in the OR with the other surgeons and anesthesiologists and stuff. Um, and then you can shadow CI surgeries. And so I recently did that. It was the best day ever. Got to meet Dr. Gergel. He is so excited to have you and to show you everything he's doing as he's doing it. Lets you look in the scope. There's also a TV there that you can watch so that you can get a really good view of everything. So that was really awesome. So I will go into my case. It's really kind of two cases because they're sisters with similar situations. But here's the case history. You can pause and read. I won't go too much into it besides pointing out that the aunt is a carrier for Pendred syndrome. Both sisters have a severe to profound hearing loss. They utilize hearing aids, and they're a military family, so they move around a lot, which can make it kind of complicated. So the sister I saw, she's the 10-year-old. This was her audiogram from her previous audiologist. They came here in 2018, so they brought that. This is an audio from 2020, so comparing the two, pretty stable over time. And then the day that I saw her, this was her audiogram. So came in reporting reduced hearing in that, sorry, that's supposed to say right ear, but she had hit her head and noticed a change in her hearing after that. They are going in for imaging, and they informed us they are also moving to Georgia in a few weeks. So I'll just quickly go back to this audio. Her right ear was her better-ish ear, and now you can see it's significantly dropped there. So as far as testing goes, in this appointment, she was pretty emotional, and I think she was scared, frustrated that she couldn't hear out of this ear anymore. And then when we went to do SRT in that ear, she just couldn't understand what I was saying. And as we increased the intensity level, she reported feeling dizzy, and I think she just got anxiety pretty quickly. So we stopped there, no response for SRT. So I will show you her sister's hearing loss just because it's interesting. So there's her left ear, there's her right ear. Here is a follow-up audio after she had hit her head, and there's a little change there in the left ear. Actually, you could call that a big change. So, she was also going in for imaging as well. So, you can see that they are definitely hearing aid candidates and, you know, m- most likely CI candidates once they do the formal CI eval. So, um, that's all I will say about them. There's more to share later, but what do you suspect is the cause of the hearing loss? And how would you counsel the parents? They have been counseled about cochlear implants multiple times, but have just not wanted to move that direction. And so it's been slow going. And what's your treatment plan? And is there anything you feel could have been done better? So I will say for the patient that I saw, we did try and adjust her right hearing aid up to that drop, and she wouldn't tolerate it. It made her dizzy. Um, she was already a little stressed out, and so we just reduced the gain significantly. Um, the only way she would tolerate it is if it was to the point where it really wasn't giving her any benefit. So we gave the family clear masks. They talked about taking her out of school because she's already been frustrated during school up to that point anyway. And so, yeah, that's all I will say about that. Oh, and I did add a little unrelated case. As I was finishing up these slides today, JJ popped in and showed us this ABR. You can see there's some ANSD here. And he had just done this in the NICU on a baby they had been trying to test for quite a while, but he clamped the tube, the microphonic went away. So just interesting. There's a real live case of ANSD, not just in the textbook. So there's that. All right, thanks for listening, you guys.